I'd like to turn to Jamila Michener, professor of government and public policy at Cornell University.
Hi, everybody. Thanks, Scott, for that introduction. And thanks, Deb and Nicole, for orienting us so, I think, compellingly to the work. Part of what we hope will come from this time that we're spending together on this panel today is just giving folks a sense, a taste of what David was able to accomplish with Ripples of Hope, so that you want more. So that you want to read it yourself and you want to learn from it and you want to use it in your courses, and you want to share it with students, with colleagues, with people in life. I mean, the holidays, it's a great gift. But even outside of the holidays, this book really is a great gift for a number of different reasons. And I just want to talk through some of those reasons. I will say and disclose that I think, like many of us, if not all of us on this panel, I knew David. And the first time that I worked closely with David was in the context of my time at the University of Michigan, where David was a PhD student and I was a postdoc. And as a postdoc, I was doing all this research on Medicaid, and I needed, to work with graduate students. I needed help in terms of research assistance. And David had a reputation for being a pro when it came to all things the Affordable Care Act and health policy. And I was really excited when I reached out to him and asked if he would work with me on some data collection efforts that he was willing to. And to be honest, I was really intimidated by David initially, even though I was a postdoc and he was a graduate student. And the reason is, because I was a postdoc in a health policy scholars program, and I was doing research on Medicaid, but I actually hadn't spent most of my time in graduate school focused on health policy. I was in a PhD program in political science, and I had stumbled into health and into health policy. And I have since then continued to stumble along and done a lot more and deeper work. But this was a sort of initial stage of my development as a scholar in this space. And I remember meeting with David and him asking me the smartest questions. I was just like, oh my gosh, this guy knows more than I do. How am I, why is he my research assistant? But it was such a generative space. And if you'd asked me then, I would have characterized David as a policy wonk, and that would have been a compliment, by the way. And some of that comes through in the book. But one of the things that I love about reading the book is that what comes through more is a real ability to connect with a broad audience and to relay kind of deep understanding of the complex root causes of health inequities. And by approaching those complex causes from the vantage point of a specific place, a place that David engaged, rooted himself in, and clearly, from no one who reads this manuscript can walk away not thinking that David had a real heart for, a real love for, a personal appreciation for the place and the people. This does not read like a book written by someone who was narrowly a policy wonk. It reads like a book written by someone who has extensive and deep policy knowledge and is able to apply that through the lens of care and thoughtfulness and true deep engagement with people and communities. And that is a very rare combination of skills to be able to bring to bear in any research product or written product at all, never mind a book like this that does so much work. So David draws us to, as you saw on a previous slide, food, education, jobs, neighborhoods, and finally healthcare as some of the root causes that help us to explain health inequities and just inequities that we observe all the time. One of the things that I really appreciate about this domain-specific focus that the book has, which brings us through different domains in each chapter, is that it helps us to see the interconnectedness between these different spaces. In academia, at least, many of us are very siloed. I study health policy, you study housing, you study education, and it's easy to really be preoccupied with the trees and not see the forest. This is a forest sort of book. You get the deep dive into the trees, but you get it in a way that forces you to always remain in sight of the forest. And when you pan out and you see the forest, it's not in a way that's distant and disconnected. It's in a way that's very much helping us to understand what that meaningfully means for people. This is a book that was written for an audience beyond academics. Otherwise, I would not recommend that you give it as a holiday gift. I don't generally recommend that for academic books, but for this, I do. And the reason is because David wrote, and you could feel it, you can hear it, you can sense it in the reading for people. The language is accessible and plain. It's even for skeptics. You don't have to already believe in structural racism, or you don't already have to be preoccupied with health equity to pick up this book and get value out of it. In many ways, the book is David making a case not only to the people who understand these things, but to the people who might be skeptical, and drawing in research and knowledge and stories and community to help make this case in a synthetic, multifaceted way. You can't walk away from this not at least considering the arguments that David makes and taking them seriously. The last thing I want to point out, just because I could go on forever about this book, but I will not, is that David brings a deep humanity to the book. And by that, as someone who grew up, I'll tell you what I mean by that, as someone who grew up in low-income communities of color, and who often when I read research on quote unquote marginalized populations, racially or economically marginalized populations, it feels like the research is done by people for whom those communities are far away, they're others, and you're sort of dissecting them. You're trying to understand them in a way you would try to understand, specimens in a lab. And while there's a lot that we can gain from research that takes that very objective, very distant, sometimes abstract, and what can feel like a cold approach to understanding people and their experiences, their struggles, I always have a hard time with that research, because I'm thinking about real people. I'm thinking about real life situations. I'm thinking about my family. I'm thinking about my friends. I'm thinking about my childhood. And it's really common that I read research, even that's focused on health equity, that feels almost indifferent to those realities. One thing I loved about this book is that you can tell that there is no indifference here, that the people and the place and the processes that David is writing about are deeply important to him, and that are understood in terms of a shared common humanity. And that means David doesn't only focus on deficits, on all of the things that people in marginalized places don't have, on all of the ways that they're stuck in webs of structural disadvantage, on all of the ways that they're vulnerable. Yes, those things are acknowledged, and David certainly centers them. But the ripples of hope come through David's focus on the assets in these communities and these people, on what they have to offer, on how we might move forward differently, working alongside them, taking them seriously as people who have agency, who matter, to change the world in ways that will be better for all of us, right? And that is extraordinarily rare to encounter in any book. So when I said at the beginning that the book is a gift, it wasn't just because I'm making a push for you to give it as a holiday gift, but it was because it really is a gift. It was a gift to me, and I think it'll be a gift to anyone who reads it. So I'll stop there.